Hello, everyone. It's Dr. Hana Sasaki here. Thank you so much for joining me today. If you're new to the channel, I'm a family physician with a special interest in emerging infections. And I've spent the last 15 years caring for patients right here in the Pacific Northwest. As a Japanese-American woman who grew up hearing my grandmother's stories about resilience and respecting nature, I've always believed that knowledge is the best form of protection. That's why I show up here every week, to talk with you like we're sitting together in my living room. Because these conversations matter, especially as we get older and want to protect not just ourselves, but our children and grandchildren too. Something happened recently that really got people talking. News outlets around the world started reporting on a cruise ship where quite a few passengers and crew members came down with a serious respiratory illness. Headlines like that have a way of stopping you in your tracks, don't they? I saw the worry in the comments of my older patients and in messages from many of you. You wrote things like, "Dr. Hana, I'm supposed to go on a cruise with my husband in October. Should we cancel?" Or, "I have grandchildren who love ships. Am I putting them at risk?" Those are honest, heartfelt questions, and I want to answer them with both honesty and calm. So today we're going to talk about the virus that kept coming up in those reports, Hantavirus. Now, I want to be very clear right from the beginning. The name itself sounds like something from a sci-fi movie. And yes, this virus can be serious. But panic is never the answer. What I hope you'll take away from our time together is a clear, practical understanding that turns fear into confidence. Because when you know how this virus actually moves through the world, you can protect yourself and the people you love without living in a bubble. Here's the heart of what we're going to explore today. Hantavirus is a rare but potentially dangerous family of viruses that travels from wild rodents into our lives through very specific pathways, usually involving disturbed dust from their droppings. It isn't floating around every corner like the common cold. It's a disease of close contact with nature's hidden corners. While the risk to the average person, especially those of us enjoying our retirement years, remains quite low, understanding exactly how it works in the body, particularly the lungs and heart, gives us the power to stay safe and enjoy the adventures we still want to have. Let's start by pulling back the curtain on what Hantavirus really is. When doctors say Hantavirus, we're not talking about one single bug. We're talking about an entire family, almost like distant cousins spread across the globe. Some of these cousins live in the Americas, others in Europe and Asia. They all share a love for rodents as their primary home, but they affect the human body differently depending on where you encounter them. In North and South America, the viruses tend to focus on the lungs and heart. That's what we call Hantavirus cardiopulmonary syndrome. In parts of Asia and Europe, you're more likely to see strains that affect the kidneys, sometimes called hemorrhagic fever with renal syndrome. I know that sounds technical, but I want you to see it as good news. Once we understand the patterns, it stops feeling like a mysterious monster hiding in the dark. It becomes something we can recognize, respect, and outsmart. The virus has been with us for a very long time. It actually gets its name from the Hantan River in South Korea, where it was first studied in the 1970s. But evidence suggests these viruses have been living quietly in rodent populations for thousands of years. My grandmother used to say that nature has its own balance. These viruses are part of that balance in the wild. The problem only arises when we humans get a little too close. And that brings us to the heart of the matter. Hantavirus is what we call a zoonotic disease, meaning it jumps from animals to humans. The main carriers are wild rodents, particularly deer mice here in North America. Here's something that surprises a lot of my patients, especially those who grew up on farms or in rural areas. These mice usually look perfectly healthy. They don't get sick. They just carry the virus in their urine, droppings, and saliva, and shed it into their environment. I'll never forget a patient I treated about 8 years ago. Let's call him Mr. Thompson. He was a 8-year-old retired teacher who had bought his dream cabin in the mountains after decades of saving. The place had been empty for 2 winters. Like many of you would do, he rolled up his sleeves on a beautiful spring day and started cleaning with enthusiasm. He swept vigorously, stirred up decades of dust, and a few days later he was in my office with a high fever, terrible muscle aches, and a look of pure fear in his eyes. That story has stayed with me because it shows exactly how this virus finds its way to us. It's usually not through a bite, it's through the air. When those tiny particles from dry droppings or nesting material get disturbed, they become aerosolized, light enough to float deep into our lungs. Once there, the virus begins a very specific conversation with our immune system, and that conversation can sometimes become overwhelming. Let's talk about the symptoms in a way that makes sense for real life. In the beginning, Hantavirus is a master of disguise. It looks and feels a lot like the flu that so many of us have powered through over the years. You might notice a sudden fever, pounding headaches, deep muscle aches, especially in your back and thighs, maybe some dizziness or stomach upset. Many older adults tell me they initially brush it off as just my age catching up or I overdid it in the garden. But here's where experience and awareness become your greatest allies. If those flu-like symptoms appear after you've been cleaning a shed, attic, garage, or any place that might have been home to mice, I want you to tell your doctor about that exposure. Don't wait. Don't minimize it. Those details can literally save your life because they guide us toward the right tests instead of treating you for a simple virus. If the infection progresses, which thankfully doesn't happen in every case, it can move into what we call Hantavirus cardiopulmonary syndrome. This is when the virus causes the small blood vessels in your lungs to become leaky. Fluid starts seeping into the air sacs that are supposed to be filled with oxygen. Suddenly, you're short of breath even while sitting in your favorite chair. Your heart has to work overtime to get oxygen to the rest of your body. Blood pressure can drop. In severe cases, it can lead to a form of shock. I know that sounds frightening, and I won't sugarcoat it. But I also want you to hear me when I say this progression is not inevitable. The human body, especially one that has weathered decades of life, carries incredible wisdom and strength. Our job in medicine is to support that strength while the immune system learns to fight back. Because there is no specific antiviral medication or vaccine for hantavirus yet, treatment is what we call supportive care. That might mean supplemental oxygen, careful fluid management, sometimes medications to support blood pressure, and in more serious cases, a ventilator to give the lungs a chance to rest and heal. I've sat beside patients in the ICU, holding their hands, explaining each step, and I've also celebrated with them months later when they returned for follow-up visits, breathing on their own and hugging their grandchildren again. That brings me to something especially important for those of us in our 50s, 60s, 70s, and beyond. While hantavirus doesn't care about your birth certificate, those of us with pre-existing conditions often have less reserve. If you live with high blood pressure, heart disease, COPD, diabetes, or if you've ever had a heart attack, your body may not tolerate the stress of this infection as easily. That's not meant to scare you. It's meant to empower you. Because when you know this, you can take even smarter precautions. I often tell my older patients that prevention isn't about being afraid of life. It's about staying in the game longer by making wiser choices. So let's get really practical. Let me walk you through exactly what I tell my patients and what I would tell my own parents. First, never, ever dry, sweep, or vacuum an area where you suspect rodent activity. That's like sending out engraved invitations to the virus. Instead, use the wet method. Mix 1 part bleach with 10 parts water or use a good disinfectant spray. Thoroughly wet down all the surfaces, the droppings, the nesting material. Let it sit for at least 5 to 10 minutes, then wipe everything up with paper towels or damp cloths. Wear gloves and an N95 mask if you have one. Double bag the waste and dispose of it carefully. If you're dealing with a larger area, like a barn, shed, or vacation cabin that's been closed up for months, consider calling a professional cleaning service that specializes in biohazard cleanup. Yes, it costs money, but think of it as an investment in your future adventures with the grandkids. Living in rural areas or spending time at mountain properties, as many of you do, means we need to be especially thoughtful. Seal up any holes in your home's foundation that are bigger than 1/4 inch. Use steel wool and caulk. Keep food in airtight containers. Remove brush and wood piles from close to the house. These aren't dramatic changes. They're quiet acts of respect for the boundaries between our world and the wild. I also want to speak directly to those of you who love to garden, who restore old furniture, who help your adult children clean out their basements. These are beautiful activities. They connect us to our past and to our families. They don't have to stop. They just need to be done with awareness. When my own father was helping my brother clean his garage last year, I made sure he had the right supplies and knew to wet everything down first. He teased me about being an overprotective daughter, but he followed the instructions. That's love in action. Now, let's address the elephant in the room that I see in so many comments. Can this spread between people? For most strains in the United States, the answer is no. This is primarily an animal-to-human disease. However, there have been rare documented cases with certain South American strains where limited person-to-person transmission occurred within households under conditions of very close, prolonged contact. These are the exceptions, not the rule. We are not talking about casual contact at the grocery store or sitting next to someone on a plane. The cruise ship situation that started our conversation was likely an unusual convergence of factors, and health authorities responded appropriately by monitoring and testing. This is why I want to speak to your hearts for a moment. I know many of you remember the uncertainty of the early COVID years. You remember the fear, the isolation, the way it affected family gatherings. Hantavirus is not that. It does not spread the same way. The global risk remains low. Public health departments track these cases carefully. When they appear, we respond. But most of us are far more likely to face challenges from heart disease, falls in the home, or complications from the flu than from hantavirus. That doesn't mean we ignore it. It means we meet it with informed calm rather than panic. This is the wisdom that comes with age, isn't it? We've seen enough of life to know that fear steals more days than most diseases ever could. Let me share another story that might resonate with you. I had a patient named Margaret, a 72-year-old widow who lived alone in a beautiful but old farmhouse. She started feeling terrible after spending 3 days sorting through boxes in her attic. The symptoms came on gradually. By the time she came to see me, she could barely catch her breath, telling me what she'd been doing. We caught it early. She spent 6 days in the hospital. The nurses all fell in love with her because she kept thanking everyone for this lovely vacation from cooking. 6 months later, she brought me homemade mochi, a Japanese rice cake that reminded me of my grandmother's kitchen. She told me the experience taught her that asking for help isn't weakness, it's wisdom. I think about Margaret often when I make these videos because she represents so many of you, strong, independent, and still learning. Our ability to detect these viruses has improved dramatically. The PCR tests we use now can identify the genetic material of the virus quickly and accurately. We've come a long way from the days when doctors had to rely mostly on clinical suspicion and antibody tests that took weeks. This faster diagnosis means faster treatment, which means better outcomes, especially for those of us who may not bounce back as quickly as we did in our 30s. I want you to think about your health as a relationship, a long conversation between you, your body, and the people who care for you. Your body has been with you through careers, raising children, perhaps caring for aging parents, and now it's entering a new chapter. It still wants to serve you, but it needs you to listen more carefully than ever. If you live in an area where deer mice are common, if you have a cabin, if you enjoy hiking or camping, keep a few simple questions in your back pocket. Have I been in any enclosed spaces with possible rodent activity? Are my symptoms more than just a passing bug? Am I having any trouble breathing that feels different from my usual allergies or mild asthma? These aren't questions that should make you anxious. They're tools that help you stay in charge of your story. I'd love to hear from you in the comments. Many of you are so wise about these things. Tell me about the clever ways you've rodent-proofed your homes over the years. Did your grandparents have tricks that still work today? Have you had to clean out a storage unit or help a child move and found evidence of mice? What did you do? Share your stories. When we exchange this kind of practical wisdom, we all get stronger. Some of you have asked about essential oils or herbal remedies. While I appreciate the desire to use natural approaches, there is no scientific evidence that they prevent or treat hantavirus. The best medicine here is prevention through cleaning methods, awareness, and seeking medical care early when needed. We can honor traditional wisdom while also embracing what modern science has learned. As we wrap up our time together today, I want to leave you with this thought. The most dangerous thing we can do is dismiss the signals our bodies send us, especially when we know we've been in a situation that might have exposed us. Whether it's a fever that lingers, muscle pain that feels deeper than usual, or breathing that feels heavier, trust yourself enough to get it checked. You've lived long enough to know your body's language. Don't gaslight yourself. You deserve to be taken seriously. And good doctors will do exactly that when you give them the full picture, including any potential rodent exposure. My grandmother used to say that true strength isn't never falling. It's knowing how to get up with grace and help others do the same. That's what I see in so many of you who watch these videos. You want to stay healthy, not just for yourselves, but so you can dance at weddings, read stories to grandchildren, travel to see old friends, and keep living fully. Hantavirus is real, but so is your wisdom. So is your ability to adapt and protect what matters most. Stay curious. Stay respectful of nature's boundaries. Keep those N95 masks and disinfectant sprays handy when you tackle those long overdue cleaning projects. And above all, keep showing up for the people you love, including yourself. Thank you for spending this time with me. It means more than you know. If this video helped ease your worries or gave you practical steps you can actually use, please share it with someone who might need it. Maybe a friend planning to clean out their late parents' house, or a neighbor who lives near the woods. Drop your questions and stories below. I read every single comment, even if I can't answer them all personally. Your experiences teach me too. This is Dr. Hana Sasaki reminding you that knowledge is love in action. Take care of your beautiful, resilient bodies. Cherish the days. Breathe deeply. And I'll see you in the next video where we'll talk about something many of you have been asking for, how to protect your immune system naturally as the seasons change. Until then, be well, stay informed, and remember, you've got this.